Hi, my name is Taimoor Malik, and today I will be representing a topic in presentation related to tuberculosis in Pakistan. So, it's a club journal presentation, and I have selected a particular article to discuss and correlate it with the disease spread in Pakistan and how it should be treated, how the findings of those articles can be implemented to prevent tuberculosis in Pakistan. So, tuberculosis, as we know, is a contagious disease. It's a bacterial disease mainly caused by Mycobacterium tuberculosis. So, the spread of this disease is mainly through person to person by coughing, by sneezing, and the organism goes into the droplets and then spreads to other persons. So, uh, there have been 2 million deaths reported annually worldwide, and different countries share a huge burden of TB per annum. So, if we talk about Pakistan, so Pakistan stands at six in that TB burden. So, there have been a number of cases related to tuberculosis in Pakistan, and Pakistan share a huge incidence, prevalence, mortality, and morbidity rate regarding tuberculosis. So, with regards to introduction to tuberculosis in Pakistan, tuberculosis (TB), as we have discussed earlier, is caused by Mycobacterium tuberculosis, and it has caused 10 million new infections and 1.5 million deaths globally in 2020, with Pakistan among the top 8 countries with the highest TB burden. So the Bacillus calmette-guerin vaccine, the BCG vaccine in use for over 100 years, shows limited efficacy in preventing pulmonary TB in adults, emphasizing the need for new vaccines. So the introduction of thermostable vaccines, as we will discuss in this article, IG93 plus GLA-SE vaccine offers potential advancements in TB prevention, particularly in regions like Pakistan, where there have been issues like cold chain storage and non-thermostable vaccines. So, first of all, we will go towards the objective of the presentation. So, first of all, if we go for the assessment, we will assess the safety and immunogenicity of the thermostable IG93 plus GLASC TB vaccine compared to the non-thermostable version. And then we will evaluate the impact of a thermostable vaccine on TB prevention strategies in Pakistan, where cold chain logistics pose significant challenge because there have been issue in cold stage maintenance of vaccines. So as we know that vaccines are mostly not thermostable. So the advanced vaccines now that have been produced are mostly thermostable. But in countries like Pakistan, there have been issue to maintain the cold chain of vaccines. And thirdly, we will discuss how the study findings could influence TB vaccination policies in high burden countries like Pakistan. So if we go to the article overview, so the phase 1 trial involved 48 participants to compare the thermostable IG93 plus GLASC vaccine with its non-thermostable counterpart. So safety was evaluated through local and systemic reactogenicity, while immunogenicity was measured by antigen-specific IgG and T cell responses. So the thermostable vaccine demonstrated a higher IgG levels with a mean endpoint titer of 10868 versus 2583 for the non-thermostable vaccine at day 70. So if we go through the relevance to clinical practice in Pakistan, so the thermostable IG93 plus GLASC vaccine could enhance TB vaccination coverage in Pakistan's remote areas by overcoming cold chain barriers. Because in metropolitan cities, it's not that much of an issue. There's infrastructure from the government. The different health departments are working there to ensure the cold chain storage of the vaccines. But if we go into the remote areas where TB is more common in countries like Pakistan, because in remote areas people do live in a kind of congested societies, so there have been increased incident rate of TB among those individuals. So in order to give them access to vaccine, it is important that we should maintain the cold chain. And if we are not able to maintain the cold chain, then go for alternatives like the vaccines that are thermostable, like they don't require a cold chain facility for a particular period of time, so that the vaccines remains viable and its efficacy remains the same. So second, the vaccine's ability, the second objective is to the relevance to clinical practices, the vaccine's ability to elicit a strong immune response. So overall, we need to, the vaccines are basically made to improve the immune responses of a particular person against a specific disease. So the vaccine's ability to elicit strong immune responses, including 190.5-fold increase in IgG at day 70, could significantly reduce TB transmission in Pakistan. And thirdly, the vaccine's robust safety profile with no grade 3 or 4 adverse events supports its integration into Pakistan's national immunization programs. So there have been different research questions that come in this article that like how does the safety and immunogenicity of a thermostable IG93 plus GLASE vaccine compare with the non-thermostable formulation? Means what is the comparison between them, the thermostable and non-thermostable formulation? And then what advantages does the thermostable formulation offers in terms of distribution and efficacy in regions like Pakistan? And thirdly, can the increased immune responses observed with the thermostable vaccine translate into better TB control outcomes in high burden cases? So these will be the other summaries of the research question, and we will later give a uh, brief answer to these questions. So if we go through the critical appraisals of methods like the randomized double-blind design, minimize bias, ensuring reliable comparisons between vaccine formulations, and comprehensive immunological assays, including ELI Sport and ICS, provided detailed insights into cellular and humoral immune responses. So when we go into the critical appraisal of methods, so we, as the vaccines are mainly related to the immune system of the patient. So we will go towards the immune status of the individual, and we will go through cellular immunity and humoral immunity, which involve T cell production, B cell production, and antibodies production. So the small sample size and lack of placebo control are limitations in critical appraisal. So, but previous studies on IG and ID93 plus GLASE vaccine support the trial findings. So then evaluation of the results. So thermostable vaccine significantly enhanced IgG responses with a 97.4-fold increase at day 84 compared to 32.2-fold for the non-thermostable variant. So there's a kind of huge difference between the immune responses that are produced by thermostable vaccines as compared to non-thermostable vaccines. And if we talk about the T cell responses, so T cell responses also show the trend towards higher magnitude in the thermostable group, indicating a strong Th1 type immune response. So Th1 type of cells, Th2 type of cells, these are all related to cellular immunity, and they do play a vital role in combating a disease. Or when you are introducing a vaccine into the body of the individual, so these cells really counter or combat with the disease causing agents. So thirdly, the vaccine safety profile was excellent, with 98% participants reporting mild or moderate adverse events. So there were no side effects or very moderate side effects when the vaccines were injected into those individuals. So then we'll talk about discussion application to Pakistan, because the motive of this is that we will try to uh, implement the studies of those that article, to how we can implement those studies in Pakistan to prevent TB cases and to better combat this disease challenge. So the thermostable vaccine's ability to maintain stability at 37 degrees for 3 months addresses the logistical challenges of vaccine storage in Pakistan. That's a huge challenge that this vaccine can cover. So, implementing this vaccine could lead to significant public health improvements by enhancing TB vaccine coverage in rural and un, uh, un, underdeveloped areas. And thirdly, the collaboration between local health authorities and international partners will be crucial for successful vaccine deployments because this vaccine is not being produced in Pakistan. So, WHO and different health organizations need to contribute in this to eradicate this disease or to get it to the minimal status of disease in Pakistan region. So, the global and local implications. The thermostable IG93 plus GLASE vaccine could revolutionize TB control efforts globally, particularly in low resource settings like Pakistan. So, for Pakistan, this vaccine could reduce the incidence of TB, especially in regions where cold chain logistics are a barrier. And the successful implementation of this vaccine in Pakistan could serve as a model for other countries facing similar challenges. So, what would be the challenges in implementation? Like uh, ensuring equitable access to the thermostable vaccine in Pakistan remote areas remains a significant challenge. This is the first challenge and a very significant challenge. Secondly, cultural barriers and vaccine hesitancy must be addressed through targeted public health campaigns because there has been some myths related to vaccines that if we go for vaccination programs, particularly in some rural areas of Pakistan, it will cause some adverse effects. So these issues needs to be addressed through proper campaigning. So thirdly, training healthcare workers to handle and administer the vaccine effectively is essential for successful implementation. So, what would be the recommendations? So, first of all, prioritize. So, prioritize the rollout of a thermostable IG93 plus GLASE vaccine in Pakistan National TB control strategy. That it should be included. This should be included in the national TB controls strategy, which goes on every year, and this policy should be inducted into that TB control program that we should introduce this kind of vaccine. Second is enhancement. So we should enhance public health infrastructure to support the vaccine distribution and administration in remote areas. And thirdly, to conduct further research to confirm the vaccine's long-term efficacy and safety in diverse populations. So, in conclusion, uh, the thermostable IG93 plus GLASE vaccine represents a promising tool in the fight against TB with significant potential for impact in Pakistan. And specifically, it would also be useful for other countries that are underdeveloped in terms of vaccination technology and advancements. And that model can also be implemented in those countries to counter the spread of TB. So, the strong safety and immunogenicity profiles of this vaccine supports its use in TB endemic regions, offering a practical solution to current vaccination challenges. And thirdly, continued research and collaboration are necessary to fully realize the vaccine potential in global TB control efforts. So it should be continuously monitored, continuous data should be gathered about the efficacy of these vaccines, and it should be then implemented in different TB control programs. So, what would be personal decision? So, we should reflect on the impact of this research on personal and professional decisions in public health. And second is considerations like we should consider the importance of supporting innovative vaccine technologies that addresses global health challenges. And thirdly, we should commit to staying informed about advancements in TB vaccine research and their implications for public health policy. So, then the references have been given. Thank you very much.